So good afternoon, everyone. I am Tamika Williams, and I am a Senior Health Information Technology Advisor here at Intelligent, and I would like to welcome you to the Ophthalmology and Optometry peer-to-peer call. So Intelligent has really designed this forum to give specialists an opportunity to share their experiences and learn from others about their MIPS journey. So this is really an opportunity to learn what others are doing in their specialty, to hear successes and challenges they face. This is definitely a forum that we are expecting for you guys to share with each other. We are making that connection, and we're hoping that you'll have valuable conversations together and get a chance and opportunity to learn and see what others are doing. So this call is intended to be pretty informal. Just note that the lines are open during the call, so please remember to not place your call on hold or mute so that we will not get your whole music. So today I'm joined by two of my colleagues, Michelle Bunson and Kelly Smith. Hi, ladies.
Hello. Thank you, everybody, for joining.
And so let's kind of go round robin a little bit to see who we actually have on the call. And so I know I had a call in from Judy. Judy, do you want to introduce yourself and let us know the organization or practice that you're with?
Sure. I'm Judy Eastman. I'm with Eye Consultants in Omaha, Nebraska. We have 2 ophthalmologists and 2 optometrists.
Welcome, Judy. And there's also Danette. Danette, you want to take a moment to introduce yourself?
Sure. My name is Danette Miller. I'm with the American Optometric Association and specifically work on the AOA More registry. So I'm hoping to answer any questions and just kind of listen to your concerns as well. So thank you for having me.
Thank you, Jeanette. And then there's also Teresa.
Hi, my name is Teresa, and I am from the Optometric Center in Charles City, Iowa. I'm the billing manager here, and we have 2 optometrists in the practice.
Welcome, Teresa. Is there anyone that I missed? Okay. Thank you for attending. So we'll jump in and just try to get a feel for, I'll kind of start off with some questions that should try to gauge our conversation today. So let's talk a little bit about what the practices on the phone did for 2017. Can you talk a little bit about any of, like how you reported, what measures you reported for 2017? Did you do any reporting? Were you reporting via individual or group? So just talk a little bit about that amongst the group. Is there anyone that wants to start?
I actually was just pulling out my MIPS attestation handbook from last year and was just going to go over the measures that we reported on. But I needed a second to kind of get that handy.
Okay, sure. That's fine.
So we were reported through IRIS Registry, through the American Academy of Ophthalmology.
Okay.
And so that's kind of a different way of doing it.
And can you talk a little bit about how they collected your data, or what was the expectation that your practice had to do in order to report those measures?
So the way that it interfaces with our computer system, so every month or every quarter we have a conference call with IRIS Registry and review where we are with our results for each of the measures that we've identified that we want to track, as well as any of the other measures. Knowing that as we move forward, probably measures will be added, so we're continuing to look at which ones we would choose if that were to occur or when that occurs. And so we just kind of develop processes to make those changes and provide education to the staff at staff meetings or individual tech meetings or reception meetings, whichever one it pertains to. And then we provide those quarterly updates to the doctors so that they can see how they're doing. We have scribes for our MDs, and then our ODs do all their own documentation, so that adds a little bit of twist to what we have to work with.
Okay, great. Thanks for sharing that. I like the fact that you were providing the updates kind of on a routine basis. Anyone else want to talk about their process for collecting the quality measures?
This is Teresa, and just wanted to say that we use our software, which is CompuLink, to, within the EHR, track the different measures and report on them. And then we use the MIPS website to enter all of that information when it's time to report. And we also use AOA More, but had quite a bit of problems last year with CompuLink interfacing and uploading that data correctly to AOA More. And so we ended up just having to attest to those measures on the MIPS website, and we reported each doctor as an individual.
Okay. I think someone just joined us. Did someone just join us? Okay, maybe not.
Yes, I did. It's me, Carrie Thompson.
Hi, Carrie. How are you?
Great. I had myself muted. Sorry, it took me a second to answer.
Oh, no, that's okay. We're just in the middle of, so this forum today is basically a sharing call between the specialists. So we have on the line with us, we have Judy, and she is from Eye Consultants. We have Danette from a registry, if I'm not mistaken, and then we also have Teresa. And so we're just in the process of, or they're in the process of sharing how they submitted for 2017. So do you want to take a moment to introduce yourself and tell us a little bit about how you reported MIPS in 2017?
Sure. I'm Carrie Thompson. I'm the billing manager at American Eye Care, and we have 4 doctors that we reported for last year, and we have 4 locations as well. I ended up, we have CompuLink, and we are linked up with AOA More, and that didn't work out that well for us, so I kind of caught the tail end of someone speaking of that when I got on, and I ended up just doing some claims reporting, so we ended up doing okay that way, but kind of made it through by the skin of our teeth, so.
Yeah, this is Danette. It was really, really unfortunate the way things worked out with CompuLink at the end of the year, but we are working with them now. They are testing again for 2018, so we do have some other vendors that are live and submitting data, so I do hope that that we can get them across the line so you guys can get that data in.
Yes, definitely. I'm definitely counting on that for this year. So, and thanks, Michelle helped me so much. So, I was able to get that accomplished and felt good about it. So, yeah, this year I'm kind of holding out and hoping that all works out correctly. And I apologize if I have to hang up in the middle of this conference. I do have a meeting I was supposed to attend at 11, but I just wanted to get on here and listen for a while. So.
Okay. Well, thank you for joining us. Basically, this is kind of a sharing call, so the expectation is that, you guys can talk about any challenges, any success stories that you have, any tips and tricks you want to share. This is basically an open forum for you to do the sharing and the talking. I'm just here to facilitate as needed, but feel free. Does anyone know, or can we talk a little bit about maybe if CompuLink is certified for 2015? I think I saw a message come across my screen about that.
It's my understanding
Yeah. Go ahead.
Go ahead.
Go ahead. I was thinking that they did have that. Is it CHERT? They had that 2015 done. Yeah.
Yes, they are. It's my understanding they are certified 2015 cert.
Yes, this is Jeanette. I know that they did reach that certification.
Okay. Anything else about maybe how you selected your quality measures, or how do you know, or how did you go about the process of choosing the right measures? And have you checked to see if any of the measures you reported have been topped out this year? Are there anything in that area worth noting?
What do you mean by the measure being topped out?
So basically, when you get to certain measures, depending on how many benchmark points you're wanting to earn, it depends. So the measures, you can look at the submission mechanisms, and then for each submission mechanism, so the measure has a benchmark, and based upon how everyone the population of the universe of the people that submit that measure, you get scored on that measure. And if the measure reaches to the point where it's, for lack of a better term, kind of easier to get to the 100%, for so many of the reporting periods, that measure will become kind of topped out, meaning that, the benchmark for 100% is easier to get to, and you'll get, less points for reporting that measure.
Okay. That's kind of what I thought it was, but I wanted to make sure.
Mm-hmm.
And do you know which measures those are that are sort of topped out?
So there are quite a few. I'm sorry, did I interrupt someone?
No, go ahead, Tamika. That's just Michelle. Go ahead.
Okay. So there are a couple measures that we have listed here that are topped out for all of the reporting mechanisms. And so several of them will be like measure number 14, which is age-related macular degeneration. And it's the dilated macular examination. That one seems to be topped out for all reporting mechanisms. Some others are measure 117, which is diabetes eye exam. Another one is measure 130, documentation of current medications in the medical record. Measure 141, primary open glaucoma, reduction of intraocular pressure. And measure 192, cataracts, complications within 30 days following cataract surgery requiring additional surgical procedures. And then measure 388, cataract surgery with interoperative complications. Did I miss any, Michelle? We haven't covered.
No, I think.
Okay.
Yeah, those are. That's one for all that are topped out, and then there are some that are topped out mainly just for claims, and a couple for registry, because those are older mechanisms that people have used compared to the electronic health record. And so those are in addition to that. And because they're topped out, they will look at the possibility of getting rid of those in a certain amount of years, depending on if they will go through a 4-year process to eliminate those, or they just put out something in the proposed rule that there might be others that they don't have go through that long of a process that have to be approved by rulemaking. And they want to make sure that every specialty has enough measures to actually report on. So even though there are some that are topped out or maybe more in your area, that doesn't mean they'll get rid of those until they have new measures. So I can't remember if it was Judy or Teresa that said, until you get different measures, that they'll wait to delete those, and they'll give you plenty of notice that, hey, we're going to delete this by next year if it gets approved, and or even 3 years from now, we're giving you heads up. But being a part of the qualified registry and the qualified clinical data registries, they are looking at ways to provide new measures, and so that's where they will get their ideas on which measures that are important to that specialty. They do want to make sure you have enough measures, so it may not even mean that it'll be on the list to be removed in the next 3 years or 4 years, but just so you know, topped out is something we want to kind of keep our eye on, if that makes sense. And I am lucky enough that I get to work with all three of you, and so thank you for joining. And so when we go through our WebEx process, kind of looking at that, even for 2019, after that final rule is out, we'll know which measures and what they decided on for the rule, if it needs to be topped out in 4 years or less. We'll go through those, and so hopefully that'll be out here in November, but just so you know, that is something that we will watch.
And this is Jeanette. The AOA right now, we're formulating our comments for the proposed rule, and there are 3 measures that CMS has proposed to be removed in 2021. And as part of our comments, we are requesting that they hold off on removing those until 2023. I'm not sure if, that will happen, but that is part of the comments that we have prepared. Because unfortunately for optometry, there are just not that many measures that are available to us. So and we are working as a QCDR to develop our own, what we kind of refer to as homegrown measures, but that would give optometrists a few more options as we consider, and look forward to some of these being removed for us.
That's great to hear, Jeanette. That is wonderful. That's exactly what they're waiting for. So it's hard when there aren't a lot of measures for your specialty, Right. That's been, and then finding outcomes measures has been difficult for us. But
So should we just quit reporting on these tapped out measures, or should we still continue to report on them?
So, you want to get the maximum amount of points possible, and when a measure is topped out, you'll see when we look at this Excel spreadsheet, and I try to show everybody that spreadsheet, but if I haven't, forgive me, but so you'll see it starts at 3 points, and it might be 92% to 94%, you get 3 points, and 4 points, it might be 94.1 to 96. And then 5 points, 96 to 99.9. And then 7, 8, and 9 points aren't even an option. And then 10 points would be 100%. So what's happening is a lot of people are getting 100%, which is great, but then they say, okay, we're not getting a lot of different quality being looked at. So that's where they, name them, quote, topped out. But then that's where then the registries and the qualified clinical data registries, or QCDRs, that's where they come in to suggest new measures, like Jeanette was saying, for the homegrown measures. And then also being your voice to say, please don't get rid of these 3 measures that you had proposed, because we're not quite there yet. And so they have to take all of those comments from the proposed rule. They have to take those all in together and address every single comment that was made. So the more comments they get, they say, oh, that has more weight, or like a registry or qualified clinical data registry that helps make new measures, they even know maybe more what's on the horizon. Does that make sense?
Yeah, I understand that. I just, so obviously you're not getting many points, but should we still continue to do it just to... Yeah,
we always want to report on 6 measures. And so if you have obviously different measures that aren't topped out, you may even want to say, let's start working on this workflow, and we're probably doing part of this, maybe we need to change it a little bit, but in the end, you may score, let's say, and by the time you run the reports out of CompuLink, you may score 53%, which doesn't look good compared to like, hey, we're doing 96% on this other top-down measure. But that 53%, when we run those, I like to run all quality measures so we know like what your EHR can run and look at, and that's what I'm looking at is 53% may actually give you 9 points because it's a newer measure or because you're using your electronic health records report, like for CompuLink if you weren't able to get that interface with AOA more yet. And so that's what I do when I look at those, and what I'll try to do is explain this is how I'm watching it, but then I'll go through your whole list, you know, to say these are the ones that you're getting the most points. So I say try to, as much as you have available in your specialty, try to work on the measures that aren't topped out and the workflows and getting those in place, and then, but continue to do the good work that you are on the topped out measures because, okay, you might get 100%, we'll still submit that, and that's fine, even though it's topped out because you got 10 points. But if you scored 98% and you only got 4 points, we'll say we're not going to submit that measure. You guys already started implementing your non-topped out measures at 53% and giving us 9 points. And so I don't know what the rest of the team thinks, how they suggest it, but because there aren't a lot of different measures for these two specialties, I say to try to, you know, do as much as you can within your scope.
This is Teresa.
Yes, go ahead, Teresa.
My question is, we have to report at least 6 measures, but are we better off to report more so that way we can kind of pick and choose which one gives us the best outcome?
I'll take that, and if you want me to here, Tanika. So yeah, so absolutely, because when you submit electronically, you get an extra point for submitting electronically. And what they do is they allow you to submit more measures because they're capturing data there too, right? So they're like, they want to receive even more measures than the required amount. And then they will score those and say, we will give you the best score possible on that, on those measures. So what you thought, you may have had A, B, C, D, E, and F, and submitted G and H, and they might not take F, but they'll take H instead. So they always choose the best ones, and then you get the extra points for G and H for your 7th and your 8th measure for for submitting electronically.
Okay, and so what if at the end of the year when we go to submit, like through AOA More, our registry, if that doesn't work with CompuLink and we have to fall back then on what we reported on claims?
Claims you would not. They would only score the top 6.
Okay.
But so that's the one thing they're trying to get rid of. And even actually in the proposed rule for next year, they're proposing to take away claims for everybody except small practices like ourselves here.
Oh,
and
wow.
so that's how much they're trying to get rid of that. And so they first start off with saying, we'll give you more points if you do electronically. And now they're saying, you know, we're going to propose that claims is only able to be submitted for small practices to score your quality performance category. So that's how much they want to get away from that. Just because it's more manual intervention and mistakes can happen, and, you know, they're trying to go more on the electronic side with registries, with QCDRs, with EHRs. Tanika, do you want to add something to that?
No, thanks, Michelle, for sharing that information. I think it was very valuable. Thank you. Is there any other questions or any other discussion around that?
This is Jeanette. I have a question for Teresa or any other CompuLink users that are on. I know one of the issues that we had last year was that during CompuLink's 2015 certification, they removed the the ability for providers to export the QRDA3 files, which could be just directly uploaded to the QPP website. We learned that near the end, I think for some people they were able to reinstate that. So Teresa, do you know, is that functionality available to you for 2018? Do you know?
I do not know the answer to that. Currently what we're doing is through CompuLink we're using a system called Practice Watch, and supposedly every week it's set up to take all of this data and push it to AOA More. And I haven't actually gone on to AOA More's website to check to see if that data is in there currently, like on the dashboard. I mean, that's the current process that we're using right now, and to be totally honest, I should take the time and go on there and just see if it's working, because I hate to be, you know, at the last minute in a crunch trying to check to see if the data's there and it's not, and then what do I do?
Right. No, and I
can common. You're wearing a lot of hats, Teresa.
Yeah. Right. Oh my goodness. Well, there is no CompuLink data in AOA More at this point. I mean, just because they're still in testing. So for the 2018 changes that needed to be made, and I know that what they have shared with us is that they are working on a new update, a new version that will include the AOA More fixes and updates to bring so whenever they release that, and if it says it has AOA More on it, then you'll know that we're ready to push that data onto the live dashboards.
Okay, so this data that they've been collecting weekly, that's just sitting somewhere probably? Like,
yes.
They haven't AOA More?
It's like a holding tank that once we get the final integration piece finalized, then they will push the data from the holding tank into AOA More. Okay. Well, let's cross our fingers that that's going to work. Oh, I know. Yeah.
It is. So this was January of this year, and we're now in September, and they still don't have it fixed and ready to.
Yeah, no, they don't. But yeah,
it's a lot. It's a lot, and I know, you know, having worked with an EHR company before and building those interfaces was a huge deal. Back even when I was, you know, working there. So it's difficult, but once you have it, it just works so beautifully. You know,
right,
it's so nice.
Right. And our setup is different than the IRIS setup, where the interface, the mapping was actually from each individual practice to IRIS. Ours is different, and you know, in retrospect, we're wondering, you know, this was supposed to be an easier way, but I think once it all gets going, it is going to be great, but it's just painful in the process.
And Teresa, as well as Carrie, for the CompuLink to know if they have a QRDA3 format, it's just a special format CMS asks, that's the one format they can receive. And if they can just all you do is roll that up into a file, and then we upload that file, and it takes literally 3 seconds, and they'll say, thank you, we've got your data. So that's what Jeanette was wondering is, can they do that as a backup if AOA More is not able to? And so I do think that's something that we should have you ask either Teresa or Carrie, since you were their client, they're more in tune to speak with you about that instead of me, but if they have that capability of QRDA3. So I'll send a reminder email to both of you. Just
good.
Thank you.
And I'll be checking on that too, just because I'm curious myself, and want to be able to help our members.
Yeah.
So the QRA file, would that be uploaded to AOA More, or would that be done on the MIPS website?
That's actually done on the MIPS site.
Okay. Mm-hmm. So we would create that file and then upload it when we attest.
That's right.
Yeah.
Okay.
Do you have anyone else that joined the call? It looks like I have someone on the attendee list. Maybe Kayla?
Yes.
Hi, Kayla. How are you?
I'm good. How are you?
Good. Thank you for joining us. This is just really a sharing platform, as you can probably tell. We're just kind of opening the floor up for discussions, and people were going through and talking about their reporting plans for 2018, and also some of the reporting that they did in 2018 as well. Do you want to introduce yourself and tell us where you're from?
I am from Conroy Eye Care in the Lake, South Dakota. I have heard most of this call. I just had to leave a few times to answer the phone, so I've just missed out on a little bit.
Okay. All right. I just saw your name on this thing. I wanted to make sure I introduced you. Thank you.
You maybe called on me before and I was on the phone or something, but I have been here for most of the call. I just got taken away a few times.
Okay, great. Welcome.
Thank you.
Did I miss anyone? Colette? Okay.
Yes, I'm just listening along.
Okay. Any other things around that area? Anything else, Michelle, you think we should point out or that we missed or that should be open for discussion?
No, I think around the quality piece itself, no, it's just, I guess, mainly the measures and how they report, and that's good that we've gotten some discussion even around here. So I just want to thank Danette for joining. That's great that you're able to be on the call too, Danette, from AOA More. So was it Kayla from Conroy Eye Care? I'm sorry, I missed your first name.
Yep.
Kayla. Now, do you mind if I ask how you reported your quality measures, and did you have an electronic health record to help you do that, or a registry?
We do use an electronic health records. We did not use a registry last year. We just did through the MIPS website. We are, I think, going to be trying to use AOA more this year. I actually just registered for it. I'm kind of behind because I didn't think we had to do it this year because I didn't think we met the measurements. And I got a call about a month ago from somebody actually trying to sell us something to help us, and they were like, "No, you come up on the QPP website." So I went and checked it, and I was like, "Oh goodness, here we are." So we've kind of been slacking off. We've kind of been slacking off for a while, and then realized that somehow I don't know how we qualify because we don't meet the $90,000 from my calculations, but somehow they think we do. So now we're just trying to play some catch up here a little bit.
Yeah. Well, good for you. Now, did you have any measures? How'd you score on your measures, if you don't mind, the quality measures? Was that a pretty good score from the EHR MIPS submission?
Ours said like 100% on the QPP website. Is that where you look? Is on that
awesome
website?
Yeah.
Yeah, it's at 100% of what we did. So we were doing that, and then we just kind of started slacking off. So.
Yeah. Hey, that's all right.
We still continue to do a lot of them because, they advise, you might have to do it the next year, so we still continued. But, when it doesn't count, you kind of slack off a little bit. So we're just trying to be really good now for the next few months.
What measures did you report, Kayla?
What measures did we report? Oh, God. I'm not even sure. I'd have to go find my stuff, I guess.
Okay. No,
but I guess some of those were the ones that you said were topped out. That's why I was questioning that before, because there aren't, in an optometry, we don't have very many we even can report on. So we report on all those topped out ones, which makes me wonder. But I know we reported more than 6 measures. We kind of did anything that even applied to us. And then just whichever ones, I guess, were best scored on or what we went with.
Okay.
Great. And I will say, Tamika, that Karen course. She is one of our partners. We're so happy that she's on the call. I think she might still be on the call, but she had made a comment, Jeanette, to maybe if you want to be encouraged to reach out to IRIS as the new licensing agreement CMS has for year 3 would allow them to use all of the IRIS QCDR measures. And then I don't know if you're aware of that, and they need to understand there are 2 of their Compulent measures that have multi-performance levels in year 2. Oh, yes, we can talk about that too. Karen, are you on the call?
Thank you.
Yes, I am, Michelle, and I have to update. I'm trying to go back and forth between CopyLink and the multi-performance measures, and I found 3 now.
3, okay. Well, so you want to talk a little bit about those, Karen?
So probably a lot of you are doing the BMI, which is CMS 69 and the version 6. This year, that ECQM is going to have a weighted average. And so to be able to understand that, you have to look at the measure specifications on that as per the ECQM and then understand how it's a little bit different this year than it was last year. Same thing goes for, I think I noticed that there is the CMS 137, which is the engagement of alcohol and other drug dependence treatment. I think I saw that on the CompuLink. That's a version 6. That has a simple average on the multi-performance. The WAVE assessment and counseling for nutrition, physical activity for children and adolescents, I think I saw CMS 155 version 6. That has the overall performance is a simple average. The tobacco use has a new performance rate. I think I saw that one. So that's actually there's 4 of them that I am seeing just by trying to quickly go back and forth on the measures that I saw on CompuLink and the ones that are in the multi-performance category. And then in terms of the AOA more, I looked at the ophthalmology QCDR measures that IRIS has, and since I also work with QCDRs for the chiropractic group, and I've been trying to. We don't have any QCDR measures. I'm not sure if you do. They're not that hard to actually develop, and get approved. But I do know that the licensing agreement really says that when you reach out, for example, you reach out to IRIS, that they're obligated to work collaboratively with you. So that might give you some additional measures as well. And by now, or by next year, that probably will have some benchmarks on those as well. And so then that helps to expand the number of measures that the clinicians have available to them, since a lot of these are topped out.
That's great, Karen. Thank you so much. I appreciate that. Always good information. Lots going on. Yeah. You can tell.
Okay.
So, Tamika, that's all I have for the quality piece anyway.
Okay. So maybe we can jump into another one of the MIPS categories and talk a little bit about those. Let's maybe get into discussion around the improvement activities. Anyone report improvement activities in 2017, or what are your plans for 2018 in that category? I know that me and Michelle and I were talking before the meeting, and we talked a little bit about in the proposed rule there is proposal for a medium-weighted improvement activity around comprehensive eye exam.
Yes. This is
something proposed anyway. Jeanette, did you want to say something?
That was something that the AOA had proposed. We were really excited to to see that that was part of the proposed rule. If it is accepted, of course, that would go into effect for 2019. But currently, just to let everyone know, regardless of our integration status with any of our EHR vendors, even people who do not use an electronic health record can still enroll in AOA More if they are AOA members to take advantage of the improvement activities. We have, in fact, I'm working with our builder right now. We just have updated the platform, so there'll be kind of a new look and feel to AOA More when you do log in. You'll be able to pull into the improvement activity portal or page there. You can pull in any improvement activity that the QPP lists, but some that we'll be highlighting just for people that use AOA More. Patient engagement resources, which is IABE7. We will have just a list of, 10 or 12 different resources that a practice can download, can put into their waiting room, can also share with patients. There's, contact lens hygiene. There's, the fear with Halloween coming up of decorative contact lenses, the dangers there. Digital eye strain, smoking, vaping, all of those. So we've got a lot of different handouts that you could download and use. Another one that would be very simple would be that you participate in a QCDR that has interoperative learning opportunities that are interactive. We'll be providing webinars throughout the final quarter of 2019 or 2018 that you can watch, document that you have, and then you'll be able to attest to any improvement activity through AOA More. And I don't mean to monopolize the conversation, so I'm just going to be...
No, that's great. That's helpful. Thank you, Danette.
Yep, thank you. Anything else around improvement activities? This year, improvement activities is still going to be, 15% of your total MIPS score. Anyone have any questions about submitting those improvement activities or how you submitted them last year? Did most people submit directly through the portal?
We submitted directly through the portal. This is Teresa. I'm just curious. Anyone use the, what's it called? There's like a survey that you can implement. Did anyone use that?
That's the CAP for MIPS survey you're talking about, Teresa, do you think?
Yes.
The vendors? Great question. Judy or Carrie, I don't know if Kayla's able to be on the phone still, but...
We did not utilize that.
Is that the improvement measure where you could send out a survey to your patients? Is that what you're talking about?
Yes.
Yes, and you do pay for you pay the certified vendors.
I guess we just did a survey on our own that we mailed out with our billing and just kept track of all of our surveys. And I guess we had something, I think it showed that you had to, show that you were using those surveys at some point. And so we, I guess, made notes on them and maybe contacted patients based on those surveys. And I guess we didn't use any, like our EHR or anything to do the surveys. We just sent out paper surveys and kept all of them, I guess, to prove that we did a survey and use those to improve things.
That's great.
That's a idea.
It was, I guess, the easiest one that we thought we could do.
Sure.
Just pick the easiest thing, and I don't know what we're doing yet this year.
Okay.
And just so you know, you can still do that for this year, unless that improvement activity specifically says that, like, you can only do this one every 4 years. I think there's some out there, like with training through the CDC and other things, but you can do that again this year, because I specifically asked that question.
Okay, I was thinking you could only do one of them ever, and then you always had to move on to a new one.
I know. I kind of am surprised, but maybe if you think about, like, a lot of those improvement activities, you're still going to be learning, like, if we use that one, you'll still learn from those surveys, and maybe as you make changes, you might hear positive feedback, you might hear brand new things this year, so I think that might be why. Tamika, do you have any thoughts on those?
Yeah, I would agree with you on that one. That's the one that I think that says, collect and follow up on patient experience and satisfaction data. And I guess that's just, it's always something you can learn from that and glean some insight, to improve something in your practice with that. So I would agree with you on that, Michelle.
Great. Yeah, it's one of those categories, even though it's new, I mean, that was my go-to for everybody if we had the 90 days, if they weren't sure of how to participate, because if the claims, were already, they weren't using that method and it didn't work out, then we'd go through the improvement activities next. So it's a good one. And I think they're going to add 6 new activities, is that right? Yeah, 6 new and modify 5, and then remove 1 for this next coming year is what they're proposing. It doesn't mean it's going to happen. So once that final rule comes out, we'll take a look at those too. But I like that comprehensive eye exams, Danette. Thank you.
Yes, we were really excited about that one for our doctors.
Absolutely.
Can you summarize what that means, the comprehensive eye exam that's in the proposed rules?
Yeah, I can. Actually, my colleague Kelly here printed it off for me, so thank you, Kelly. And I'll just read the proposed activity description. It's about 8 sentences, so bear with me. In order to receive credit for this activity, MIPS-eligible clinicians must promote the importance of a comprehensive eye exam, which may be accomplished by providing literature and or facilitating a conversation about this topic using resources such as Think About Your Eyes campaign and or referring patients to resources providing no-cost eye exams such as American Academy of Ophthalmology's Eye Care America and the American Optometric Association's Vision USA. This activity is intended for 3 different groups. 1, non-ophthalmologists or optometrists who refer patients to an ophthalmologist or optometrist. Number 2, ophthalmologists, optometrists caring for underserved patients at no cost. Or 3, any clinician providing literature and or resources on this topic. This activity must be targeted at underserved and or high-risk populations that would benefit from engagement regarding their eye health with the aim of improving their access to comprehensive eye exams. And so so for people on this call, it'd be groups 2 or 3, either caring for underserved at no cost or providing literature on the topic and, really trying to make sure that the underserved or high-risk populations definitely get those resources, either free exams or literature. And it's a medium weight, by the way. Did that answer your question?
It does, thank you.
You bet.
Thanks, Michelle.
Yes. You're welcome.
Anything else around the improvement activities or, anything else around the improvement activities? I know, if not, I have a question. I think that in the beginning, someone mentioned that they were 10 in multiple locations. If they're still on the phone, are you willing to share like how your workflow is about collecting data and how that worked for you last year and what you plan on doing for that this year as well?
I think that was Carrie Thompson, but I'm not sure if she's still on.
Oh, that was Carrie. Okay.
Might not be.
Yep, she might have had to jump off. Okay. Anything else that you guys think that will be beneficial to discuss or add value to you for 2018 you want to talk about?
How about the promoting interoperability category? Since it looks like we all have EHRs.
Mm-hmm.
How about any challenges like with portals or with other offices knowing their direct address to send a summary of care? I don't know if you want to speak with that. If you had anything that would make it easier that you seem like you tried to implement that helps more patients sign up, or a way that you were able to get more other practices to give you the direct address, or if they understood the direct address concept and what they needed to give to you?
This is Teresa at the Optometry Center, and we have been having some difficulty with CompuLink. We've been collecting direct emails from other providers, and we've been forwarding the document to them about a patient's exam, and they've been unable to open it. And I called CompuLink and reported this, and they don't seem to have an answer, don't understand why they can't open it or what's wrong with it. So, I've had luck in getting the direct emails from the people that we send patients to, but it seems like the technology that CompuLink is using is not working.
Wow.
And we have received CDAs or CCDs or whatever they're called from other offices, and when we open them, really the only information it has in it is medications and allergies. Any of the review of systems or problem list, none of that is coming through.
So they have it on the record and they meant to send it to you and it didn't come through?
Well, I don't know if it's just like a communication between the two types of softwares, that it's just not getting it. I mean, it comes through, but it's blank. It just has a date, like in the review of systems, and it has, say 6 or 7 dates, and there's nothing there. No data.
Okay.
So it's really kind of useless. They're sending us these documents, but really the only thing that's in it is what medications they're on and what their allergies are, but, it doesn't tell them, the doctor, what they saw at their last visit. So, and CompuLink just doesn't seem to understand why it's not working.
And have you, Teresa, have you contacted like an office to say, hey, do you mean to send us the review of systems, or are you just leaving that off thinking we wouldn't need that, just to make sure that they know that you would like that? You know what I mean?
Oh, sure. Well, it looks like it's coming through, but there's nothing in it. Like it's coming through blank. Like it's not transferred correctly when we import it into our EHR.
So you think that in the actual file, it's just that when it kind of transmits, it's not, when you open it up, it's just not there.
Right.
Okay.
Yep. And the same thing is happening with what we're sending other offices. It goes over there, and then they say it's just blank. There's nothing in it. So, I don't know. I don't think that whole process is actually even working with our software right now, which makes it difficult to be compliant if it's not even really working. Although I think it does document that we sent it. So I guess we're checking off the boxes as far as MIPS goes, but in a workflow, improvement type of a thing, it's not really helping us.
We use
right.
and we have the same issue. I was called by one of our ophthalmologists and said that when we send it to them, they get it, but and I don't remember what information was missing. I think it actually had all of the information, but it didn't even have the patient's name or birth date in there. So they'd get all this information and not even know who it was for.
Oh my goodness. And you have CompuLink also?
No, we use Optometry Exam Writer.
Okay.
We were sending it to, maybe they use I don't think they were using CompuLink, but and it's not just CompuLink. It's ours is, and I can't think of what they were using, but both of our programs have the same issue. So I don't know why it's such a global issue with different softwares, but ours is doing the same thing.
Okay.
So Michelle, this is Karen, and
yes, Karen.
I've worked with this experience with different software companies, and when they go through the testing process, this is not an uncommon issue where some of the fields and that are required to be able to count the measure are not there, and it truly is a coding. It's a coding issue. So whenever that happens, when you receive one, that it has nothing in it from a vendor different than the one that you have, or that someone receives a CCDA file that has any field that you know you had data in that's missing, then you need to let them know. If it's a different vendor, you need to let the sender know, by the way, there must be something wrong with your coding. These fields were blank. Or if it's yours, then you let your vendor know, by the way, when we send out our CCDA file, this particular field is not reflecting data. But what is important for us to do in the meantime is to check and see whether your performance rate is increasing, or if because there is a field that's missing, and that's because the 3 fields are required for the care summary to be calculated, if that is actually not increasing your performance. However, in the measure specification, it also states that that there can be conditions where you are not, if you will, it's not a negative thing, because you can still end up getting performance credit for the attempt. And it says that right down in the measure specification on it. But it is interesting to look to verify how your EHR is. So when you receive one, then go in and check and see, did this numerator denominator performance on this measure change? If not, then you have even more significant or urgency to contact them and say, hey, this isn't working for us.
Okay.
You can always try to go through a secure portal, not through their direct address, if that makes sense. Because sometimes it's the secure direct address that's causing the error. But it's a coding issue within the EHR system itself, because when we went through all of the testing with ours, with Epic and with some of the other EHR systems, we would put data in there, and when they would receive it, it would be blank in that area, and they had to go back to the coding, if you will, and modify that.
Okay. Well, thank you, Karen, for that information. It looks like we have some very good discussion going on, but it looks like we are about at the top of the hour for our time today. I wanted to give a special thanks to Karen Korth and Catherine Ingram, the two of our partners. Thank you for attending today. Thank you for all the great input that you gave us on this call today. Thank the rest of you for attending. We hope that this has been beneficial, and Television looks forward to hosting more of these sessions in the future. So just be on the lookout for invitations for other specialties. You may can forward on to some other specialists that you know of. We'll also have 2 for EHRs in the near future. I think we're doing ECW and Allscripts. And we also will send out an assessment after this call to each of you that was on the call, just to get some feedback from you. So again, thank you for joining us. If you have any questions, on the screen is the email addresses and phone number for myself and Michelle. You can feel free to reach out to us after this call.
Tanika, this is Michelle. I was just going to say one more thing. If you would if any of you would like to be open to sharing your contact information and want to share that with the others on the call, we could certainly do that as well. And it's totally up to you, but it's a way for, you to keep talking to each other if you needed it.
Awesome. Okay.
All right. Thank you so much, everybody. We really appreciate it.
Have a good afternoon. Bye-bye.